Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. It's a beautiful fall day outside. It's amazing. I actually love to walk around a little bit, but that's, after you listen to us, and we have very special information for you, as always. The keys to turning your health around. Perhaps you've had a problem, you've tried, you've applied. Well, we're going to give you a different opportunity. How about without drugs, without surgery? Well, this is your information post to get that done. 888-630-9625. That's 888-630-9625. Love to talk to you. Give me a call. We'll talk about your problems, and we're going to talk about a very special problem, something that, unfortunately, way too many of us suffer from, and there's all kinds of different reasons why that occurs, and we're going to explore some of them that you may not even be aware of. And to help me do that in studio, and will be your host this Wednesday, the 30th of the month, Dr. Scott Lamp. Dr. Scott, welcome.
Good afternoon.
Good to see you again.
Good to be here.
Sometimes we miss each other in the office. There are days that go by that, that I walk down one end of the hallway, you walk down the other, and it's a big enough place that sometimes we miss.
Yeah, I'm a tall guy. I'm hard to miss, though.
This is true. They let me know that you're there. Nevertheless. Now, we won't even get into the Star Wars stuff, will we?
No, we won't.
Not
shall
today.
Not. We shall not.
Not today, right? Yeah, I thought that was really good. So if anybody wants to know Dr. Scott's Star Wars name...
Do you really have to go there?
Then you have to come to the class Wednesday night. See? And then I'm going to put a sign up on the door. And I'm going to say what it is. Maybe.
Retribution.
You can pay me. You can pay me now. You can pay me later.
Retribution.
I know, it's a lousy. It's ugly, isn't it? Anyway, we're talking about GERD, gastroesophageal reflux disease, that heartburn that you get that goes up into your throat and gives you problems, and your doc puts you on all kinds of medications and makes life extremely worse for you. But, Scott, let's get into it a little bit, because it's, all kidding aside, it's a very serious problem. It's one that plagues, unfortunately, millions of Americans.
They say almost about 50% of the population get involved in this.
That's not a good thing.
No.
And it comes from so many different wings, if you will, of onset. So first, let's talk about what is it? What's GERD? What really is GERD?
Well, GERD basically is you have a sphincter. It's basically, there's a place when you swallow, eat food, it goes down. There's actually, as you chew food, you have one compartment, which is the upper part of the compartment, and then there's a cardiac sphincter right before the beginning of the stomach, and that particular valve closes off. And when you're ready to finish to digest or get that digestion part going, it dumps in the stomach, and the body goes down, breaks it out, creates, that's where we start breaking proteins down and other foods, minerals, and so on and so forth. But it has to be a strong acidic environment. The problem being is sometimes that sphincter fails, and all of a sudden you have a backlash of fluids. Now, there's certain cells on one side of that inside the stomach that actually can work with very high acidity. On the upper end, on the other end, more towards the head side on that sphincter, it's not supposed to have those kind of cells. So basically, they get irritated, they get burned, it gets a reflux, and that's what it is. It's the gastrocontents get spilled or regurged back up, and it gets irritated to the tissue, and over a period of time, that can create some very, very nasty effects. One, change the chemistry of that area or the cells there, and then secondly, could also cause over a period of time they're concerned about cancer.
Okay, let's break this down, anatomy 101 for everybody, okay? Because I'm listening, every time I listen to you or I listen to Dr. Browning, you guys are just like over the top, ridiculously smart, and sometimes we've got to tell people what really happened. So see, we have lips, and then there's this thing called the mouth, and then there's this tube, the food tube, that goes all the way down and it enters the stomach. Okay, follow?
Right.
And then we have this thing called the stomach. So this food tube goes into the stomach, and it has this ring around it, and that's what you were calling the cardiac valve. Right. And that's what's supposed to happen is food's supposed to go from the mouth to the esophagus into the stomach, and this valve is supposed to close.
Correct.
And it's supposed to stay closed.
Correct.
And it does it for a lot of reasons. And there is the mechanics of this thing that we're going to talk about. There's the biochemistry of this thing we're going to talk about. And we're going to talk about the neurology that's hooked up to it that causes all that medicine just doesn't really talk about.
The emotional aspect plays a part here, too.
And there's the emotional piece as well. But first you talk about acid. But gastroesophageal reflux disease ain't about acid all the time. Excuse the French. Or, the change of the English literature there. But here's the deal. It can be, when you talk about a burn, an irritation, if we looked at a pH scale, an acid-base scale, one side of the scale is acidic, the other side of the scale is acid, or alkaline, right? And then one side burns, and the other side burns. They both burn. Right. It's like if you got a garden and you wouldn't put way too much lye on it, which is alkaline, then the garden is going to burn. And anybody who's ever had a garden knows that can take place. So we're talking about both ends of the spectrum, not just acid. And all of the medications that are out there are directed, for the most part, to suppress acid production in the stomach.
Correct.
That in of itself is a problem.
Right.
Okay. So let's talk about what happens. Let's talk about the causative factors. And we're going to get back to that. So what we have to remember on this is that it's not just acid. It can burn for a lot of different reasons. And as you and I were talking about in the car on the way up, there's some funky bacteria that come into play as well that a lot of people have been finding, which we've seen and known about for a long time. But nevertheless, let's talk about what happens, why. What's the mechanics of this thing? What's the neurology of it? Let's just take it a little. We're not going to give away your whole lecture, but some of it.
Right.
Okay.
Well, let's take a look at for if you even talk about even like the chemistry aspect in regards to certain types of foods that we have deficiencies that help create acids in their stomach, and sometimes those are actually lacking. Zinc, as we get older in our 50s, there's usually a zinc deficiency, and we need zinc to create hydrochloric acid in the first place. And so there's one aspect right there that if you're actually making sure that your nutrition's the right way and you got those things in, you can actually create the right kind of acid that you need to create. But sometimes we don't have that due to deficiencies.
Well, the thing that people have to understand is you need acid.
Right.
You have to have acid produced in your stomach. You have to have pepsin. You have to have all these other enzymes that the stomach produces. Right. And we're going after acid as the primary culprit when in most situations, once
acid's
you reach
needed.
Acid's needed.
Right.
And the thing is, once you reach the age 50 or 60, at that point, generally across the board, you produce about 30% of the hydrochloric acid, the digestive enzyme that you did when you were 20.
Correct.
So it ain't about acid necessarily here.
Right.
All right. So,
well, I think we're talking about and I think your point you're trying to go into this direction is acid's a good thing in a lot of cases when we're trying to do it. And I think let's go start with the aspect of what's proper digestion first place, because this really is talking about proper digestion and properly the upper part of the digestion. We first experience when we try to eat something, we smell the food, it gets into our brain, we got to get the salivation, that sizzling sound of some type of food, or you're looking at some type of food, and that starts the salivation of you start getting more juices in your mouth, so to speak. So when you first start digestion, it's actually the process of actually realizing the food in front of you. There's an emotional component, there's a brain component there. The second part of it is then you have to chew your food. You have to break it down. And as you break it down, there's signals from the mouth down to the gut to tell you what's coming in. And the more you chew your food, especially protein, it actually sends more signals to the gut to actually create more acids. But if we swallow the food, gulp it down, fast society and stuff like that, we don't get that kind of, we don't get that response. We don't get the acids that are there. So the acid maybe not be as strong enough.
My guest in studio, Dr. Scott Lamp, be your host this Wednesday evening, 7:30 p.m. at the Roselle Center for Healing. We're talking about the topic he's going to be talking about Wednesday night, GERD, gastroesophageal reflux disease or heartburn, chest pain that can become from that, erosion, potential cancer problems like Barrett's disease, and we're going to talk about a little bit about Barrett's esophagitis. If you'd like to join Dr. Lamp and you'd like to find out how you can put the fire out, so to speak, once and for all, and really turn this thing around, which is totally possible, give us a call at 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend this Wednesday evening, October the 30th, presentation on GERD. Trust me, if you're on all kinds of medication, you're going to find out why in a few minutes you need to get off of them, because you're destroying your health. You are totally destroying your body's capacity to assimilate other things that are necessary, and it's a catch-22, one that is not good. And unfortunately, medicine, even if they know it, Scott, it bugs me because they don't, they want to hide underneath the shell. They don't want to take responsibility for this stuff. But let's talk about that, because not about that, but we're going to get into that. Okay, you got a patient, and you have to explore the reasons behind it. You have to understand what's going on. Why? We talked about the valve. The valve doesn't close, so you're getting a regurgitation of stomach contents. We said that it can be alkaline acid. So what are the mechanisms that get involved that all of a sudden people hit a certain point of their lives, and sometimes very young? Why these things, give me 2, 3, 4 of them. Okay, well, another one could be, since the sphincter doesn't close, it's under neurological control. So we talk about being things in the triangle between structure, chemistry, and emotion. Is there a possibility that something that's actually it's lost its capacity to actually close fully? I mean, that's one of the elements there. So it's a neurological element that can affect these sphincters, both on the, when I say the sphincter, this kind of valve or closing door that's on the top part of the stomach, and also the closing door on the bottom part of the stomach. So there's even things that can reflex back from that point. So that's a structural component that we can take a look at as a possibility. One of the things that I've seen over the period of many years is a patient has an injury, they have a fall, right, and then over a period of time they start complaining to their doctor, seems to be unassociated, that they have heartburn or their chest hurts, and the doc says, well, you must have GERD. The doctor doesn't understand the reason for that if he traces it back. So when you have an accident, a whiplash accident, a car accident, a fall, you're going to affect many different nerve centers. One of them is the longest nerve in the body, called the vagus. Comes from the brain, comes all the way down, and it's affected by structural malalignment or malposition. The other are the nerves that come from the middle of the shoulder blades that go to the stomach and cause that gut not to fire properly as well, causing that acid to get way too high. Yeah, and we're talking about that's the mechanical means. So the mechanical aspect is affected. So now you've got a door that doesn't quite close, and then you got some spillage. The other part of the nervous system, too, is also what's the stress mechanism that plays a part here. When we're in a flight or flight response trying to get away from danger, we're not worried about digestion. We're about what saves our butts. And if that's going to happen, sometimes digestion takes a side part. And so basically we don't start digesting very well. So what happens, what they call the autonomic nervous system, we have the parasympathetic and sympathetic parts. Parasympathetic really means rest and digest. Sympathetic means kind of like fight or flight. So if we don't have that rest and digest aspect, we're kind of paralyzing that to some extent, and we don't digest well. So things now don't move a lot slower than they're supposed to. So in a society that we're constantly stressing out, if you will, yes, at the workplace, in the home place, we have bills that are over the top and so forth, we're constant sympathetic overdrive. Right. And the stomach and the organs of digestion basically shut down. And when we eat something, we don't digest anything. So if you're sitting there, by the way, folks, unfortunately, listening to the talking heads on television every night while you're eating your dinner, big mistake. It should be quiet, because if you're like me and I watch those fools out there, I get crazy and I get mad and I get irritated and my food's not digesting. And we do that to ourselves, unfortunately, but that's the fight-flight response. Yeah, how often do we have a fast food culture where you're running through and it's like, it's like you have to run to the soccer game. You're running through, mom's got a whole bunch of kids in the back of the car, stressed out, throwing them some food, or quality of the food's bad in the first place. And secondly, they're stressed out trying to eat it. They're not relaxing. There was a thing that at a time we used to sit back at the dinner table, either have a prayer or just meditate or just calm yourself down and appreciate the food coming into the body. And that makes a big deal. It is a really big deal to try to be able to absorb that food correctly. It's called being in the moment and appreciating what's in front of you and getting your body to calm. We don't do that. We don't take the time. When I was a kid growing up, I grew up in a very Catholic Italian family, and, you sat down and you prayed. You gave thanks. You did those things. Other people meditate. Other people listen to music. Other people, but stay away from the craziness that doesn't allow you to relax. We're going to talk more about GERD coming up after a very, very short break. October 30th at the Roselle Center for Healing, Dr. Scott Lamp. We'll be right back.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. Yes, we are in studio. 888-630-9625. That's 888-630-9625. That's how you find us here in studio. And if you'd like to talk to us off air, or if you'd like to just send me a note or send Dr. Scott a note, all you have to do is go to rosellecare.com. That's ROSELLECARE.com, and we will respond. I promise you. We will get back to you. If it's a quickie and, you have to know something like yesterday, call the office, 703-698-7117. And that's the number that you were going to call to register for Dr. Scott Lamp's presentation this Wednesday evening, October the 30th, and he's going to be talking about GERD. Gastroesophageal Reflux disease, and if you're on any of the medications, any of the protein pump inhibitors, any of the antacids, over a long period of time, you're hurting yourself more than you can possibly imagine, and you need to get off of them. And we'll talk to you why that's true and what you can do about it in a couple seconds. But, Dr. Scott, I want to go to the phones. Okay. Rex, thank you for calling. How can we help you, sir?
Well, doctor, thank you for taking my call. In the course of the last 2 weeks, I encountered an individual who was advocating consumption of organic apple cider vinegar along the lines of a tablespoon or two mixed with 4 to 8 ounces of water once or twice a day. And at first I thought, well, that sounds like in line with the things I've been hearing from your show. And then I went on and discovered that vinegar itself was an acid as opposed to alkaline.
It's acetic acid. It's acetic acid.
Yeah. And so I was just wondering your perception, whether you're pro, anti, or agnostic pertaining to that being a regular practice.
Never agnostic. Never. Always have an opinion. So here's the deal on apple cider vinegar. You want to run with it, Scott?
Well, why don't you take this one?
Okay. So acetic acid is what apple cider vinegar is. However, it's one of those things that when you put it into your body, it actually gets in and goes alkaline. It converts to alkalinity. Subsequently, it's been touted for years as a arthritic treatment, and it actually works pretty well. It also helps digest the system. So when you get up in the morning, it has to be on an empty stomach. You put a tablespoon to 2 tablespoons of organic vinegar, and some people will also advocate some Tupelo honey in it because that also alkalizes the body. The combination of the two on an empty stomach, make sure it's empty, first thing in the morning, you don't have to do it multiple times a day, will help alkalinize the system because it converts into an alkaline substance inside. So I'm all aboard. It can't hurt you. The only thing that could be a problem is if you happen to be allergic to apples or you're having some other problems that way. It doesn't seem to harm most patients with GERD problems. It can, but it's one of those things that it depends on the individual. So I hope that helps you, Rex. Does that make a difference?
Thank you very much.
You're welcome. Steve, are you there?
Thank you for taking my call.
You're welcome. What can we do for you, sir?
Well, listen, you were talking about the esophagus, and down the esophagus goes water. And I have a person that I've been working with in prison, and he had to take a urine test. And over the course of 3 hours, he had nervous bladder, and he couldn't go. And he said he drank literally gallons of water. And he finally went. It took 3 hours in after midnight, right? And then he said he's been feeling really sick for the last few days.
He will. He's going to feel sick and weak and washed out and no energy and could even hurt all over his body.
Right, and he runs. He's a runner, so he runs every day. And I'm just worried that his could you tell me what he should do? What I could advise him to do. He's in prison.
Okay, if you can get sea salt to him, not regular salt, give him at least. He begins to remineralize, probably the equivalent of about 1/4 teaspoon of sea salt, no more than that, measured a day for probably 2, 3, 4 days. Get his water consumption down. Whatever his body weight is, cut it in half. And that's the number of ounces of water per day he should be drinking. When he's out running, he can go a little bit more than that. He can go up to maybe 50% more. If he's a long-distance runner, if he's in prison, that's not going to happen.
No, he does. He runs a track, and he runs like 7-8 miles.
Okay, so maybe 3 liters. How big of a man is he? How heavy is he?
He's really thinned down in prison. Probably 200 pounds.
Okay,
pounds.
So he needs on days he's not running, he needs to do about 90 ounces of water a day. On the days that he's running, increase it another 30 to 40 ounces, but no more than that. Anything other than that's going to dilute the mineralization. And what's happening is his body's starving for those minerals, and the heart and the nervous system and the adrenal glands and so forth are going to not function the way they should. And he could potentially, and some people have died.
Oh, I know, yeah.
From it. So,
could I ask you, the days running he should take how much?
The days that right now, to reestablish him, you want to give him about 1/4 teaspoon of sea salt, not regular sodium chloride, sea salt, divided maybe 3 times throughout the day. And then after about 3-4 days from now, when he's gotten back to normal, then give him about 1/8 of a teaspoon of sea salt per day in water. And that's plenty. That should do it.
Also,
and how much water should he be taking? You said when he's not running, 90 ounces.
90 ounces. The days that he's running, you can add another 30 to 45 ounces to that.
And also make sure, since we're on topic with this, one of the things is make sure you don't drink a lot of that water when you're eating.
Got it. Okay.
Yeah, he's going to dilute his food and so forth.
The acids that you're trying to break things down with.
Jeff, thanks for calling, Steve. Appreciate it. We'll be back in a few minutes after some very, very important messages and the news, and update you on Dr. Scott's presentation this Wednesday, the 30th of the month, at the Roselle Center for Healing. This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health, Health is a Do-It-Yourself Program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself Program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle web store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle web store on Amazon.com today. Visit drtomroselle.com and click on Roselle Web Store. That's drtomroselle.com and click on Roselle Web Store.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
All you need to do is give us a call. We'll be right back. Don't go away. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio. It's beautiful outside, but stay here until we're done so you can get all the data that you need to get to protect yourself, help yourself, and turn your life around so you can live healthfully, you know. Your Health is a Do-It-Yourself program, which is the title of my book, by the way, and if you don't have it, shame on you. You need to go to rosellecare.com, ROSELLECARE.com, and get yourself a copy, and not only for you, but for the people that you really care about, because it is a step-by-step of how to turn your life around. We're here at 888-630-9625. Dr. Scott Lamp is my guest in studio, your host this Wednesday evening at the Roselle Center for Healing. We're going to be talking about GERD, Gastroesophageal Reflux disease, that so many of you, and Dr. Scott said, up to half of the population, 50%, can experience it. And when that happens, it's a warning sign. And by the way, as we said before, it's not just acid. It could be the other end of the spectrum. It could be alkaline. But we're going to get into, I want to talk to you later on in the program about the depletions that some of these medications cause and the side effects, because people are suffering. It's like, you know, a spin-off. This is one of those things where you take this medication for this and then another medication for that, another medication for this, and pretty soon you see people that walk in our office literally with 8, 9, 10 different medications. And then you ask them the question, which one of these did you get on first? And it's amazing what they begin to tell you. Every medication has that capacity. There are medications that are necessary for a short period of time. There are medications that are life-saving. And, you know, everybody's saying, oh, my God, Tom Roselle is saying that some medications are necessary. But
you hit it right on the head. It's supposed to be a short period of time. And I think a lot of times, like even these, what they call protein pump inhibitors, are supposed to be originally supposed to be there only for maybe 5 to 6 weeks to clear up the problem. But people felt so good with it, they kept on pushing and pushing and saying, hey, I want to take this longer. We've got people in there multiple years on this stuff. And the consequence is like basic digestion means I want to eat the food. I need to break it down to a point to where I absorb the things that are proper for me, the proper nutrition, and then poop the rest of it out. And if I can't break that stuff down, I keep on pushing that acid down and down and down. Wait a minute. I can't rebuild my body. I got things that are missing here. And also, it also works to sterilize our gut. So, you know, we have a hollow tube that goes from the mouth to the anus of the body that basically we are still exposed to the outside environment. We're supposed to process this material so that we can neutralize it, get rid of some of it, and then what the things that we want to have, absorb and bring it back into our body. And if we're not got that proper balance in the stomach, that creates a havoc for a lot of things.
You know, people don't understand that there's a responsibility on their part.
Right.
To be able to walk through the woods, so to speak, and figure things out and what the impact is, and not just bow at the altar of the White Tower doctor, no matter who it is. And if you've heard me say on my program many times, don't believe anyone, including me. Do your homework. Check it out. Find out what's really out there. And then make your decisions on an intellectual basis. Don't go into an absolute belief system just because somebody who has a couple years of education tells you. And we go back to, you know, to the old story is, you know, the guy that's at the top of the class in medical school who got straight A's and the guy that's at the bottom of the class, they still have the same title. It's called doctor.
Right.
So be careful. You know, be careful what you do. It's imperative that you understand the mechanisms of your own body and how things happen. I want to talk about the different bacteria that cause gastroesophageal disease, and most people don't understand that there are bugs and that can churn up the gut and cause not only burning sensations and chest pain, but also can decrease immune function. Before we get into that, I want to take a real quick call. There's several waiting. We're here at 888-630-9625. George, thank you for calling. How can I help you, sir?
Hey, I absolutely love your show. Look forward to it every Sunday.
Thank you, my friend. I appreciate it.
My question is, read the book several times, Eating Right for Your Blood Type, and I'm A positive, and I suffer from GERD as well, and I find it to be really right on spot. I don't know if that's something that I want to believe in myself, or is there something to that? I have actually two questions. That would be the first one.
Okay. So let me give you kind of a blanket statement about blood type dieting. First of all, I'll say it this way. We use it as a basis when we deal with many patients nutritionally in our practice. It's a starting point. And the reason it's a starting point is that each one of us has greater amounts of hydrochloric acid and pepsin and gastrin and all the digestive enzymes that we need to break certain foods down. And whether you're an A blood type, an O blood type, an AB or B, whatever, those blood types, again, crave and need certain types. We can also extend that into body types. And there's a thyroid body type and a pituitary body type, and there's an adrenal type and so forth. Again, what we find, not 100% of the time, but so at such a high level that these situations create certain needs and demands for nutritional products within the body. So when D'Adamo, and actually the work was originally started by his father, put forth this book a lot of years ago, he said that there are certain body types, there are certain blood types specifically that can handle foods, and other foods to them are poisons. So you're an A blood type, and actually there are two types of A blood types. There's an AA blood type and there's an AO blood type. Those are phenotypes. Now, an AA blood type, and you'd have to do a special test and request from the laboratory to find out, that would make a perfect vegetarian, a perfect vegan. I mean, no animal products whatsoever, only vegetables, but combined in a certain way. And if you're going to do vegan properly, you have to know really how to do it, making sure you're getting all types of vitamins, so you're getting your proteins, you're getting your nutrients, and so forth. An AO blood type needs to have a little bit of protein substances. They can have a little chicken. They can have a little turkey. They can have some fish. And again, and I always err in our practice to organic. Organic is the way to get things done. So yes, I support blood typing diet. Is it 100% across the board? Nothing's 100% across the board. We used to think that B blood types couldn't eat chicken, but we found through applied kinesiological muscle function testing and other laboratory substantiation that that's not true, that they actually can handle some. Can you cheat occasionally? Yes. Are there things across the board that nobody should touch? Pork is one of them. It's the filthiest meat on the planet because pigs, sweat through their feet, and so they accumulate all this high-level toxin. They eat their own feces. So now you've got tremendous high levels of parasites. So it isn't a good substance, not something that any one of us should go anywhere near. So we could talk about this all day long. Matter of fact, what I'll do is I'll have Sue on with me at some point, and we'll talk about this on a much more broad-based level. Appreciate the phone call.
My second question is, and when I eat the foods I shouldn't eat, like everybody does, pizza being one, Alka-Seltzer, as soon as I drink it, problem gone. But I know what it does. It neutralizes the...
Sure, it's alkalizing.
Right. Now, I do take something called DGL and Mastic, which, take a DGL tablet that you want. It takes a little longer to help, but it really does. What do you feel about that?
You always want to go to the basis. If you have to go to something to put the fire out, it's your body telling you that there's a problem. And Dr. Scott and I are going to get into this in just a second. Deficiencies, if you will, in probiotic or good bacteria within the gut will cause all the problems that you're talking about and that we're talking about. So that's one of the places that you start. You have to make sure that you have adequate amounts of natural digestive enzymes. Hydrochloric acid precursor like betaine hydrochloride and any other pancreatic enzymes will support digestive function and eliminate many of the GERD problems. If you're allergic to something, you will find that you will have gastro problems as well. So all of those things have to be taken into consideration. I want to get into this much more, George. As a matter of fact, Wednesday evening, I think Dr. Scott's going to get into these things in a much more broad, detailed way. I'd encourage you to, join us. Love to have you as our guest. Dr. Scott, we have more callers, and I'd like to get to them as well, but let's talk a little bit about the different bugs and bacteria that causes this problem.
Well, there's a couple bugs that I think one of the things that also starts off with antibiotic use sometimes too raises its ugly head here too. And what happens is that when you take the antibiotic, you start destroying some of the natural bacteria that's in the system, and then you grow some of the bad ones. The first one that comes to mind, H. pylori, is one of those. It looks like a hot dog with long hair strands coming off of it, and it has a tendency of kind of shutting down some of the either increasing acids in certain cases or decreasing acids in certain cases in the body. And generally, the overgrowth is generally not a good thing. And so those are one of the type of things that get into that. And then after a while, you've got the bacteria, the problems that are there. Again, when they overgrow from that point, also starts going down, starts creeping down into parts of the small intestine. And, there's so many different things that interrelate, from stomach not breaking things down, where things are not being killed or destroyed, and there's not a sterile aspect. The viruses and things of that nature, parasites can start coming in, and we're not controlling them. They'll start hitting not only just the stomach, but hitting the small intestine, and then affecting things like we've talked about before here, as is leaky gut, where things get into the body that are not supposed to.
H. pylori and C. diff are two nasty creatures that can cause all the things that we're talking about. And H. pylori is something that is spread in some situations person to person. It can be passed animal to person, so be careful when your dog licks your face. It can be passed from being exposed to certain environmental situations. I mean, we could get into this quite at length, but you have to put the fire out with those things. You got to destroy those guys before you can ever hope to heal it. Now, there's a reason why they get involved, and this is a spin-off of what you were just saying, Dr. Scott, is that when these bugs get in there, when these parasites get in there, we have over 400 different types of pathogens that go from our mouth to our exit strategy at the lower end of our body.
Right.
And it's when we are deficient in immune functional situations like hydrochloric acid. If we don't have enough acid, we can't kill these guys. And then they set up housekeeping, and then they begin to break things down further. So we talked about the nervous system being a culprit. We talked about the emotional pieces. We talked about allergen patterns. We talked about the mechanics. The diaphragm, the muscle that cuts us in half, are one of those things that can put pressure on the stomach and squeeze the stomach and cause an actual acid reflux type of situation.
Yeah, there's something called, there's basically, you think of the diaphragm as kind of like an umbrella that as you breathe, it sits in the lower part of your rib cage. And this, like you said, the stomach sits down behind there. What happens is sometimes there's so much pressure and bad posture, sneezing and coughing. They say the sneeze comes out at 100 miles an hour from the body. You put a lot of pressure down, and part of that stomach now can get pushed up. So we talk about something called like a hiatal hernia. And so part of the stomach actually gets pushed up above the roof of the diaphragm. And so what happens there is catches some of that fluid. And again, we're getting a reflux. We're actually distorting the valve to some extent, and they have an opening. And these are the type of persons that, especially when you lay down after a meal, and you feel the acid reaction or the regurg that happens with that, and you feel like a lot of times you need to go, if I raise the head of the bed, I feel a little bit better.
This Wednesday evening, Dr. Scott Lamp will be your host, your presenter at the Roselle Center for Healing. October the 30th, this coming Wednesday, 7:30 p.m. We'd love to have you as our guest. No fee is required. The only thing that is required of you is a reservation. And to do that, you call 703-698-7117, 703-698-7117. When we are full, we're full, so please make your reservation today. Call our office. Somebody will call you back and confirm your reservation. Dr. Scott, I want to go to the phones a little bit because there's a lot of people waiting on topic. Joyce from Gainesville, how can I help you?
Yes, thank you, Dr. Roselle. We certainly appreciate you.
Thank you, ma'am. I appreciate that.
And I have two questions. My mother always got up and would take a little bit of baking soda and heat it. Well, I put it in the microwave. A little bit of baking soda in water. Okay, that's the first one. Is that good for the acid reflux?
That's alkalizing, and it may help, Joyce. You had a question on rosacea because it's on topic, and I wanted to grab that real quick.
Yes, sir.
Okay, rosacea is caused by a lot of different things, but one of the primary things that causes rosacea as well as GERD is H. pylori. And it's one that finally allopathic medicine is beginning to recognize, and it can be a devastating condition that can rip up the intestinal system, but also cause the rosacea that we're talking about. Dr. Scott, that's one of the things that I know that you're going to talk about Wednesday evening is rosacea as well as some of the other bacteria. I mean, not necessarily rosacea, but the H. pylori that causes the GERD and the spin-off of some of these things that we've been talking about today.
Yeah, I think what happens is that, again, some of these things where you're affecting, again, the gastric juices. You're also going to have an effect, especially on how well things are being absorbed in the body. A lot of these things, too, is antigens, for example, when we're allergic to certain aspects, are not being broken down fully when the stomach acids are not there, and the H. pylori can play a part on that. So you get full antigens and increased permeability into things that could actually create problems and actually shows up on the skin areas.
We have to come up to a break, and unfortunately, that's in tribute to the people who are bringing you Dr. Tom Roselle live. Don't go away. We're going to come back, answer some more of your questions. I know a lot of you are holding. We'll be right back.
WMAL-FM Woodbridge, Washington. WMAL Washington. WRQX HD2, Washington.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio. Dr. Scott Lamp. We're talking about GERD, Gastroesophageal Reflux Disease, which is the topic of his presentation this Wednesday evening at the Roselle Center for Healing on the 30th of the month. Love to have you as our guest. All you need to do is give us a call, 703-698-7117. 703-698-7117. Tell my staff that you'd like to be there with us, and we'll give you more information. Matter of fact, people kind of describe these presentations as drinking from a fire hose. There's that much information. Love to have you explore our website. Go to rosellecare.com. We're going to give you a little bit more data. We're going to talk a little bit more about these ugly bacteria. There is several of you still sitting there, so I want to be respectful. Mary, how can I help you?
Hello?
Hi, Mary.
Hi. I have, I guess a year and a half ago, I had an upper endoscopy, and because I have had so much stomach problems, and they told me I had Barrett's esophagus.
Okay. And your question?
And I just was wondering, they put me on a protein pump inhibitor, first Nexium,
okay,
which after a while started to make me sick.
I'm sure.
And then I cut down to Prilosec, about 20 milligrams, and then I cut it in half again.
Good
but
for
then
you.
Everything I've read about it, it's like you were saying, that it's terrible to be on those for a long period of time, but I'm afraid of getting cancer of the esophagus.
You won't.
So what?
Well, the first thing you got to find out is what's causing the erosion to take place. As we've been talking about in the program today, it can be mechanical, where the diaphragm is stuck, so it's putting pressure on your stomach, allowing that upper cardiac sphincter to open up and push things back up into the esophagus. It could be a very high alkaline type of thing. You could be eating things that are just corrosive, meaning they're allergic or they're toxic to you.
Hilar hernia, you could also, the aspect of, again, the emotional elements, all those are going to play a part with this.
But there's no reason, Mary, that anybody should be on that type of medication for the rest of their lives. There's very, very few conditions, and we're talking about maybe 2% to 3% of the people. Barrett's esophagitis is an end-stage product of things that have taken place over time. If you can answer the question, why is that, meaning the doctor that you're seeing, and we do that every day in our practice, then you can begin to make a difference, change, and things heal. The body's extremely forgiving, and it will heal up. One of the things that you can do in the healing process is go to the health food store and get George's aloe juice and take about 2 ounces of it 3 to 4 times a day, and it'll begin to heal anything that's in there, providing that you don't continue to irritate it. So, but the short answer is that there's much that can be done. Give us a call, Mary. I'd love to help you. Attend the lecture this Wednesday evening. Dr. Scott will give you a lot of data.
Yeah, because what you got to do is find out, like you said, you have to take care and stop the reflux in the first place, then work on healing elements, and we could cover that a lot in this class coming up.
This Wednesday evening, Dr. Scott will give you more than you can possibly think that could be on this subject. Let's go to another phone call. Paul, how can we help you? Thank you for calling. I appreciate it.
Hi, Dr. Roselle, Dr. Lamp. I had a question. I have a friend has asthma since she's a kid. She's 60 years old. She claims when she gets reflux, it could cause an asthma attack. Is that just a coincidental? And also, second question, I heard that this claim of cancer from the reflux is just based on one Australian study a few years back, maybe 64 enrollees or 164 enrollees. Can you comment on that also, please, Dr. Lamp?
Let's roll with it a little bit, Paul. Thank you for the question.
First off, with the asthma, sometimes they feel like asthma is actually caused from GERD. So when it refluxes back, it actually goes back to the lungs, causing some scar tissuing into the lungs itself. So that's some of the relationships where you have asthma and GERD. You just kind of keep it short. There's a lot of information in regards to the aspect of when you talk about cancer, and sometimes, and I was talking to Tom in the car on the way up here, when we talk about these protein pump inhibitors, some of those things that they do is actually it tells the body to shut down creating hydrochloric acid. And there's another form, there's a thing called gastrin that's formed. It's another molecule, and basically we're looking to constantly stimulate to make that hydrochloric acid, and it's constantly asking to say, hey, body, where is this hydrochloric acid? It's not making it. So what it does eventually, it starts creating a hypergastremic, which means too much of this stuff, and actually starts causing some cellular changes in the stomach itself, and you also start forming polyps. So one of the problems with this here is the aspect of trying to make sure that are we taking the medication for the right reason for a short period of time if they're doing that, but you got to get off of this stuff because eventually I think it actually makes the cancer possibilities even higher.
It does. It dramatically increases the cancer possibilities as you begin to shut down normal functioning capacity of the body and you begin to replace it with other things. There's a cost. There's a cost exchange, and that cost exchange is deadly to you. This Wednesday evening, Dr. Scott's going to get into these things on a very, very specific basis. You're going to get a whole lot of information that you can go home and apply for yourself. But this problem specifically for the greatest majority of people can be fixed, and we're going to show you how to fix it. We're here every Sunday at 12 noon bringing you the most intimate information on integrative and natural health care without drugs, without surgery. This is Dr. Tom Roselle. See you next week.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give